So, good morning, everyone. Welcome to Aristal University once again. Today we shall be looking at inventory management in healthcare. First of all, what is an inventory? Inventory management refers to the process of planning, organizing, and controlling the flow of materials and supplies in a healthcare organization. Basically, inventory itself is just a list of items that you have maybe in stock. For example, I would always like to use the pharmacy where we always have a list of all the medications that we have. That is an inventory. But then how do we manage this? How do we manage inventory to make sure we have all the drugs that we need available for the facility consumption for a specific period of time, making sure that we don't run into a shortage. So we said inventory management is essential for healthcare because it affects the quality of care, patient safety, operational efficiency, and also financial performance. So very well we know if we really don't have an up-to-date list of all the items we have in the facility, and then whatever happens to one item uh, may affect already the quality of the care we are providing, because all of a sudden a patient will arrive and then we are just taken by surprise that the farmers didn't have this particular drug that we need, but simply because there had been no requisition made, and then we are just taken by surprise. Challenges of inventory management in healthcare. We said one is the demand for healthcare services and products fluctuates due to epidemics, seasonal variations, and emergencies. With epidemics, COVID-19 taught us quite a lot about this. We had quite a number of shortages that we experienced in the health facilities, ranging from the personal protective equipment, even up to a shortage in supplies of most of the essential drug supplies due to lockdowns. Okay, lockdowns in between countries and even inside the country. All this halted the movement of goods and services across boundaries. Seasonal variations, we know this very well. Like for our setting here, many a times we run sort of specific supplies, especially malarial, anti-malarial medications. If you are not well prepared for this during the peak season, then you just get surprised to see that the little stock you have had is out. Okay. Emergencies, they come anytime. Sometimes an emergency happen, we might have an outbreak of maybe cholera, for example, to find that we only have limited supplies of even IV fluids. So the few that we had intentionally for other kind of usages will all be depleted because the demand is too high during emergencies of cholera outbreak. So all this poses a major challenge in the management of an inventory. Number two is supply of healthcare products can be affected by shortages, delays, recalls, quality and quality issues. So what we are trying to say here is that, for example, we might have a shortage, but this shortage might also come as a result of delays. These delays could be between the order we have placed to get the, the new supplies, or even a delay from the supplier side. This could even be a significant problem if this is an international order, for example. Okay, or when goods are recalled, supplies that are supposed to be made are returned. Okay, or maybe when the supplies that are the goods that are supposed to be received are not of the quality that is needed and they have been returned, or they have never been utilized because it is not the quality that has been ordered. All this causes a kind of challenge in the management. Number three, the healthcare sector also must comply with various regulations and standards related to product safety, quality, and traceability. So we all know all the goods that we consume, whether food or non-food items, the drugs whatsoever, all these have to undergo a kind of standard measures that they must pass through. Okay, but all this comes at a cost in terms of time and also money. So there are delays actually, there are delays in between because they have to first meet the necessary standards. We might have seen at the border where the goods that comes sometimes takes a number of days due to a lot of authorities that need to be cleared and also some maybe standards measures that need to be met before these goods can come across. So all this causes some delays. Let's look at inventory management models and the methods. We are going to look at these four basically throughout this lecture. We say one is an economic order quantity. We also look at the reorder point. We look at safety stock, and then the ABC analysis system. We shall get more details of this in the coming slides. So starting with number one, economic order quantity. We said economic order quantity is a model used to determine the optimal order quantity that minimizes the total inventory cost. Here we are trying to optimize, okay, just an optimal order, and the aim is really to minimize inventory cost. Okay, we don't need to incur quite a high cost for this particular inventory. So the best is to uh, do it as optimal as we can. Okay, so how do we achieve this? We have some formulations and mathematical formulas that help us estimate this kind of optimizations. The formula is given by EOQ is the same as the root of 2ds divided by the h, where D here is the demand, referring to the annual demand for the product, assuming we are procuring for the whole year. Okay. S refers to the setup or the ordering cost, the cost of placing an order. And the H here is for holding or the carrying cost, which refers to the cost of holding an inventory. What are the advantages of EOQ? It minimizes holding and ordering of cost, and of course, optimizes inventory levels. Let's look at the ROP, which is the reorder point. We said by definition, the ROP is the inventory level at which a new orders will be placed to avoid running out of stock. Okay, so this one basically refers to that point at where you are supposed to place a new order. Otherwise, if you miss it, basing on the current consumption, perhaps you might run out of stock. So it is something always critical to stay up. Okay, so the ROP is calculated by the formula D times lead time times safety stock. So the D here is our demand, and then lead time is we already mentioned about this, is the time taken from placing an order until the time the goods reach. This is the lead time, and then plus the safety stock. So if we already quantified our demand and then times the lead time, then we add the safety stock. This should be enough to give us the definition of already the reorder point. Okay. Definition of the safety stock. We say safety stock is the extra inventory to protect against unexpected demand or supply fluctuations. Okay, this is just like a buffer stock. Importance of safety stock. It caters for seasonal demand variations and also caters for unpredictable supplier lead time. Okay, so sometimes the lead time is affected from the supplier side. If these were goods we used to receive within a period of maybe 1 week or within 2 weeks, and this time it happens that the goods arrive at 3 weeks because of some delays, maybe bad roads. You already have your safety stock that should be enough to get up for this. Otherwise, everything runs into a shortage. Factors influencing the safety stock levels mostly is the variability in demand. Okay, you are already procured items that maybe basing on previous year's projection, but all of a sudden this year from nowhere you find the demand is too high. Also the variability in lead time. If previously you always know that when you place an order maybe for last year, but the maximum is like after every 1 month always you get it, but all of a sudden things change this year, maybe you're getting it after more than 1 month. This is already another factor. And then we have the service level objectives. Determining safety stock levels. We said we can use historical demand and lead time variability to determine the safety stock levels that we need. Okay. We said this is one of the simplest methods we use. Normally we do it by calculating the standard deviation of both the historical demand and the lead time. So we already have our historical data. So what we do is we calculate the standard deviation from the historical data and also from the lead times. These two should be enough to give us a better measure of what really we need to determine as our safety stock levels uh, for the current. We can multiply the standard deviation of the demand by the desired level of the service, often expressed as a jet score from a normal distribution, to determine the amount of safety stock needed to meet the service level. Similarly, we can also multiply the standard deviation of the lead times by the same jet score to calculate safety stock for variability in lead times. And then we can add the two together, and this will give us the total safety stock that we need. We shall see more in the coming slide just to illustrate this with some example. Okay, so this is just a simplified formula of already what I've just been reading in the previous slide. Safety stock, we can estimate it by using one, you say the average stock minus, the average stock, using the average stock max method. This is one formula that we use. We say safety stock formula is given by the maximum lead time, okay, times the maximum sales for our facilities. Here, the maximum sale corresponds to our maximum consumption that already the hospital is using. I will repeat, most of these formulas are always shared between business and also healthcare settings, so that's why you see words like sales here, but ours will be the consumption. And then this minus the average lead time times the average sales should be able to give us that estimate. But if we reflect back to the previous slide, actually the summary method for what we read in the previous slide is the King's method, number 2, okay, where we say the safety stock formula, we can get it by the jet score times the square root of into bracket the average lead time times the standard deviation in demand, we square it, and then plus the average sales times also the lead time standard deviation squared. Okay, all these will be able to give us a better safety stock estimate levels. Still, we are continuing with the safety stock. This is basically a summary of the previous formula as well. Jet score, okay, safety stock is the same as jet score times the root of lead time, and then times the standard deviation of the demand is squared, and then plus the standard deviation of the lead time is squared times the average demand, but all this also has to be squared. What we are seeing here is just we are trying to put really some values that represent what we see here. So, for example, if for this formula here we have a jet score of 1.65, then we just put it there. We multiply this by the root of this root sign applies to the whole of this formula here. So to the root of, for this case, we had a lead time of 2. We can say maybe this was 2 days or 2 weeks, according to the units that were used in the stock. And then times 11 squared, this one here is representative of the standard deviation of the demand. And then plus into bracket 0.43, this is standard deviation of the lead time. And then times 20, and then all this has to be squared, okay? And then giving us this in unit. This 29.3 is already giving us a measure of the safety stock levels. That is method number one. Number two, we can use the service level method. We said we determine the desired service level representing the probability of not running out of stock. We use statistical tables or a software to find the corresponding get score for the sufficient service level. For example, 1.96 corresponds to the 95% service level. So once again, this is a statistical estimation that we got from the normal distribution curve. We say that one standard deviation always, the 1.96 standard deviation corresponds to the 95% confidence interval, where we can say that we are 95% sure for the likelihood of an event occurring. Okay. And then calculating the standard deviation of the demand and then multiplying it by the jet score. Similarly, also calculate the standard deviation of the lead time and multiply it by the same jet score. And then we also add the two values to find the safety stock, just like we did in the past case. Number three, we can use periodic review system. This method classifies safety stock and specific review intervals, but not continuously. We calculate the average demand and the lead time over the review interval, and then determine the required service level and find the corresponding jet score, and then multiply the standard deviation of the demand again by the lead time and the lead time by the jet score of the review interval, and we sum them. We sum the two, okay, to find the safety stock for that particular period. Number four, we can use our simulation models. We already talked about simulation models in the previous past chapter. We apply this in situations with complex demand patterns or highly variable lead times, where we can use this method to calculate the safety stock. So simulations involve running multiple scenarios using historical data and statistical distributions for the demand and the lead times. So by analyzing the result of these simulations, you can determine the appropriate safety stock level. Number five, we can use dynamic safety stock calculations. Some business use advanced software and algorithms that monitor and adjust safety stock levels based on real-time data. This system considers current demand, takes into consideration the current demand and then the lead time and some other variables to calculate and adjust for safety stock as conditions might change dynamically. Critical ratio method. The critical ratio method compares the cost of carrying additional safety stock against the price of a stock out. It seeks to balance the cost of holding extra inventory against the cost of lost sales. The safety stock is set at a level where the cost of holding it is equal to the expected cost of the stock outs. So here we have some illustration trying to show the safety stock that we have been discussing about in the previous slide. So we earlier on already know that the critical ratio is calculated by these estimations. CR considers both time frame and the work remaining. So we can get this critical ratio by dividing the time remaining over the remaining work period. But also this is given by the same as subtracting, of course, the due date and today's date. Okay, so the date of today and when you expect things to get finished, and then you divide this by the remaining process time. Okay, and normally when we get a CR of less than 1, we said our job is ahead of schedule. If if it's greater than 1, if we get a CR of less than 1, we said our job is already behind schedule. Okay, and if CR is equal to 1, the job is on schedule. But many a times we say it's always good to be ahead of schedule than on schedule. Okay, behind schedule is already an indication we have a problem. And then we have the safety stock. Here we say it's given by the average sales times the number of safety days. Example here we have 100 quantities that we need per day, and then we divide by a lead time of 10 days, then we can have our safety stock equals to 5 days. So the safety stock SS in short is the same as 100 times 5, and also gives us already a quantity of what we need. And then the reorder point is given by the formula safety stock uh, and then plus the average sales, or for this case we say the average consumption or the supplies, and then times the lead time, and this will give us a specified quantity here. Okay, like 1,500 based on these figures that we already picked from the previous example. So this is one way of really being sure that your supply chain is meeting the demand and the supply of the system you're working in. Now let's look at the ABC analysis. We said the ABC analysis is a method to classify inventory items into three categories based on their value and importance. So in this system, we could classify all the inventory we have. Like if this is a warehouse, or perhaps this is our pharmacy with the drugs, we look at what are the most important drugs that really always we should always have them. Okay, and then what are those other ones that many a times yes we need them, but it's not as important as the first. Okay, it just in that kind of category, and then the supply, the inventory system is organized according to the demand and the supply. So we said annual usage demand is the number of times an item is used in a year. A unit cost is the cost of each unit item, and then the total value is the demand times the unit cost, calculated by multiplying the annual usage by the unit cost. Based on this data, the hospital applies the ABC classification as follows. Category A is a high value goods. This category includes the highest total value items, and they are typically high cost medical supplies or equipment representing a significant portion of the inventory's total value. Examples might consist of expensive surgical instruments, okay, or specialized diagnostic equipment. These are instruments that can cost the facility a lot, okay. So we have to really prioritize them. Otherwise, we don't have resources and we don't need to waste resources. Category B is the moderate value items. They are equally important, but not as important as the category A. Items in this category have moderate total value. They are not as critical as the category A items, as I mentioned. So this may include general surgical supplies, some diagnostic tools, laboratory equipment as well. The C category is a low value kind of category, and it comprises items with the lowest total value in terms of perhaps cost and even maybe time to order them and for their delivery. These are usually low cost everyday items such as bandages. Okay, we have gloves. We have some common over-the-counter medications. So many at times, really, they're really important in the facility, but they are not so much costly, and many a times we are not disadvantaged to always have them. Inventory management strategies. We said each category receives different inventory management strategies. Of the three we have seen, category A, the hospital may employ more rigorous inventory control measures since these are high value and critical items. Okay, this can include real-time tracking, stricter reorder, point management, and supplier partnerships to ensure these items are always available. So what always we can do here is to make sure that we have a rigorous system of handling this supply of category A items. Otherwise, we might encounter a heavy loss here and also a heavy spending at the same time. For category B, since they are modern items, the hospital may use standard inventory control techniques, periodic review systems, and maintain optimal reorder points to balance availability and also the cost control. Category C, our bandages and all the rest, we said these are typically managed with minimal supervision. These items might be ordered in bulk at economical prices. We could even order them once for larger prices as long as it is within, in larger quantities as long as it's within our usage limits. There's no problem with it. And the primary focus is maintaining sufficient quantity to prevent stock outs while minimizing also carrying costs. Benefits of the ABC system. By focusing on high-value items and optimizing their management, the hospital can reduce carrying costs and allocate resources more efficiently. Critical items in category A are always available, ensuring the hospital is well prepared for emergencies and surgeries. Also, by managing inventory based on its importance and value, the hospital minimizes the risk of running out of essential supplies. What are the challenges? In inventory management, we said high demand and uncertainties for supply. Sometimes these are the challenges. Sometimes we have a small stock, but the demand surges. And the supply might have some uncertainties. And then lack of standardization and interoperability, regulatory compliance and quality assurance, cost and waste reduction. Okay, all these are challenging things to keep a balance in between the two. Strategies for overcoming common challenges. One is we can implement inventory optimization software and analytics. We already said how data analytics can help us predict what we might need to consume in the coming months, basing on previous data or using historical data. And then adopting best practices and benchmarking. Leveraging automation and RFID technology. RFID is radio frequency ID technology. We know that this RFID always help us to locate items in the room. It can even show the real-time location of an item. Okay, which particular drugs are in which corner. By using this, and even who is already doing an inventory at the other side, all this machine can be able to make work quite easier than us using the manual techniques that is time wasting and also energy consuming. And then collaborating with suppliers and stakeholders. All this will also help at least overcome uh, common challenges. Inventory management best practice. One is by standardization, okay, by using automation and also data integration. We look at this in the coming slides. So standardization uses consistent methods and procedures for inventory tracking, ordering, and reporting across different locations and departments. Okay, this reduces errors, confusion, and also the application of work. So what happens here is if we have already a standardized way of inventory management, okay, meaning there's a central point with also a central pathway that we can always streamline and rely on. Okay, there is a better tracking and also there is a better ordering. Okay, and this means better reporting across different locations or departments. If we look at the hospital, we might have, if we take maybe the major wards, pediatric, obstetric, and gynecology, and all the rest. So in every day, there is, in each and every day, there's a consumption going on. But this consumption is variable. One department might be consuming more than the other. But as long as we have a better tracking strategy, okay, from the wards, from the nurses, from the midwives, okay, to all point of uses, and all this is centralized and standardized. That means we can always track our inventory, and the pharmacy will always collaborate with people and will know what next we need to plan. Okay, so it reduces errors, confusion, and also even the application of the work. With automation, this is here we use a software. We use software tools and systems that works automatically. They can automate the inventory tasks such as counting and even replenishing, forecasting, and even analyzing. So it keeps us always in check and always informed. Okay, because it's an automatic system and it gives alerts and we are aware and we can be able to forecast easily. This saves time, labor, and resources and improves accuracy and efficiency. That with data integration, for the data integration here, we are trying to look at when we centralize data in one place. Okay, it means that we shall always know what is missing at the extreme and where this data is generated. So centralizing data is very important, and it is one of the three steps in addition to the two we have already explained above. Now we look at inventory management best practices. We say we can use tags for efficient checkout and check-ins of medical equipment. So if we go to the pharmacy many a times, you always have those tags, okay, to make sure that everything is labeled. We know what has come in and what has gone out, what quantities are remaining. Using tags as the barcode is taking over. This you should really start to appreciate these barcodes now. We have seen this in supermarkets commonly. Why do they use this in the supermarkets? Simply because you can't be counting all the items in the supermarket one by one, and at the same time you are selling to people. So using a barcode actually saves time and even is also a way of already trying to make your calculations a bit easier because you know what price for each particular item and just a scan and just as microseconds and you are done and next person comes in. This is the same thing uh, that we can still get benefit of it in the health facilities. The RFID, I already talked about it, especially in inventory management, can help medical organizations keep track of where equipment is, who is using it, and when it needs to be serviced. Tax can also facilitate the checkout and check-in process of equipment, reducing the need for manual paperwork and increasing accountability. Okay. Stopping operations when performing a complete physical inventory. Still, we are continuing with the inventory management best practices. You can perform regular physical counts of inventory. Even with automated inventory management system, it is still important to perform the regular physical counts just to be sure. We can use scanners or other stock counting technology, selecting staff who are really attentive counters, who pay always attention to details so that the counting is really done in the best way possible, addressing discrepancies immediately. So one important thing is if you realize there is a gap or if you realize there is a discrepancy and you don't allow this to accumulate, it will always make it easier for us. But if a discrepancy arises today, in the morning, in the afternoon, tomorrow, and all this you allow to accumulate, by the time you need to correct on this, it's already taking you a lot of energy and sometimes then difficult to fix out. Performing a mock count during the planning and ensuring the cost of items counted is not displayed during the count. Uh, Features of inventory management software, we said real-time tracking of inventory levels, including quantities on hand, on order, and also in transit. Okay, so here we're using real-time tracking. We need to know which items are already with us at hand or within the warehouse. And then what are we expecting? We have placed an order. Which ones are still within the lead time? Maybe we are still waiting for them to arrive. Okay, or which ones are already in transit? They are already on the way. So this one helps make things a bit easier. And then using the barcode and scanning support, okay, for accurate item tracking. I already mentioned about the barcode. We can use the automation system for alerts to remind us, okay, low stock levels, overstocking situations, and reorder points. So sometimes it is not all about low stock levels, but we also need to look at do we have too many supplies? For example, if these are drugs, do we have really too many drugs that perhaps we don't anticipate patients to utilize them within the specified period? And all these drugs have expiry dates. So all this enables you to plan in advance, and maybe you can even make a stock donation to some hospitals where the usage is a bit faster. Otherwise, we end up with overstocking situations and a lot of expired drugs, and you have to spend a lot of money. Dumping just expired drug is a loss to everybody. Send notifications for expiry dates and product recalls. Okay, this is the same. Automation alerts can as well do that. Ability to manage inventory across multiple warehouses and also locations. This can be done through coordinations. Then centralized control and visibility of inventory data. When we centralize data, normally it's easy for us to know what is happening in each of the separate units. Features of inventory management software, we said tools to predict demand based on historical data and the market trends. It also helps in reducing excess inventory and stock outs. Supplier database with contact information and performance tracking. Automated reordering based on predefined criteria. And then order creation, processing, and fulfillment. And lastly, integration with sales and purchase orders. Customizable reports of inventory performance, turnover, and profitability. And then data analytics for making informed decisions. Integrating with accounting, e-commerce platforms, and other business systems. Data import and export functionality. Role-based access control to restrict who can view, edit, or delete inventory data. So what happens here is that in a centralized system, we always need to make sure we restrict so that nothing happens in between. Otherwise, any alternation will give us a falsification. So always there is a control to restrict, okay, and there's only maybe one person is entitled uh, to to do some edits at a certain level, but not anybody can tamper with that. And then audit trails to track changes. We also have mobile apps for on-the-go access to inventory data management. All this can be used. Ability to use the barcodes and reference radio frequency ID tags for the fast and accurate items identification. Benefits of inventory management software. We say it reduces manual data entry and frees up employees for more strategic tasks. Here you will have at least time to do other things. Otherwise, doing it manually might take you days, but the machine can just do it in few hours. Data analytics and reporting provides insights for informed decision making. It also ensures products are kept in stock and readily available to meet customer demand. Grows with the business adapting to increasing inventory needs and helps maintain regulatory compliance and provides history of inventory changes for auditing. It also reduces human errors in inventory tracking and order processing to minimize its carrying cost by optimizing inventory levels and reducing overstock, and streamlines inventory-related processes from ordering to restocking. Let's look at inventory management evaluation. Uh, Inventory management evaluation assesses how well an organization manages inventory levels, costs, and operations. The key performance indicators are the measurable values that indicate the effectiveness and efficiency of an inventory management. Some KPIs are inventory turnover. Okay, so we look at what is the turnover ratio. What is the number of days for an inventory to stay at hand, okay? And then the accuracy and even the stock out rates. So how we can monitor and evaluate this process is we first set our key performance indicators, and we know what key performance indicators is. It is something it has to be relevant to what we're working with. So here turnover ratio is really important for us to know how much is getting consumed at the what period of time, okay? And then taking the number of days we have the inventory and also accuracies and stock outlets. Benchmarking, benchmarking standards or targets that can be used to compare the performance of an organization with its peers, competitors, or industry's best practices. Benchmarks can help identify gaps, opportunities for improvement in inventory management. Feedback mechanisms. Here we say these are methods or tools. Uh, we say these methods or tools can collect, analyze, and communicate information about inventory management performance. Okay, these are feedback mechanisms. They always tell us how well we are doing or how poorly our system is doing. The feedback mechanisms can help monitor progress, identify problems, and implement corrective actions. Some examples of these mechanisms are inventory audits, and then the reports, the dashboards, and even surveys. Why we do surveys is just to evaluate already how well an intervention went. And then we look at what has been achieved and maybe how far the project has reached. Are we about to close the project and are we really meeting the point? That's why we have baseline surveys, midterm surveys, and even end-line surveys. All these are kinds of feedback mechanisms to monitor how well things are going. Uh, we look at inventory management for future trends. Already we know currently the importance, number one is the artificial intelligence, number two we have what we call the blockchain management, and then the cloud computing. Coming to the artificial intelligence, we know how important AI is getting recognized into many sectors, including the health. Currently, many of the uses in the health are getting the assistance of this system, even from inventory management up to even patient's care. Okay, even the radiologic departments currently use some form of AI, even to, to diagnostics, including even reading X-ray patterns on patient diagnostics. So all these are some important kind of things that AI has brought into medicine. But in this session, we are talking about its importance, especially the importance of AI to inventory management. So we know very well that most of the giant warehouses, especially in the developed world, actually already employ robotics, where uh, like robots can be used to carry along some heavy items that even a human can't carry. So all this helps you reorganize already your things. But not only that, because the machine can be programmed and even is able to deliver items to a location that is already specified. So within your your pharmacy or in the warehousing, uh, this this intelligence system can already help you save more energy than when you are really relying on the human uh, perspective, which might be a bit time consuming than when it's done with the machines. With the blockchain structure here, we look at where, like for example, data are collected from different units, and then they are centralized. They are centralized to a certain monitoring system in a computer. And then one computer reports to the other and reports to the other, and there is a central point, which is the consensus. Okay, so we have a kind of blockchain, different. The ledger, of course, we know this is an accounting term, which is just a book that is used for keeping records. But we know all this time everything is computerized. So this ledger here could be just another computer data that is sending to another computer, and then all these are sending to a centralized computer. The best example I can give here is actually the what do I say, during the voting process. If you might have seen, if you might have followed some kind of elections, including the U.S. elections, we have a central point, we have a central receiver that is receiving information and data of voters from all over the country. So one computer reports to the other, reports later, and then there's a central point that keeps an automatic a record of exactly what happened from all the other different points. What is important with this is that the central computer has been, the system has been set to a level that you cannot adjust anything in this system because otherwise it will not give the meaning. So it has been made only to portray exactly the collective totals of all the reports received from the smaller ones. Nothing can be tampered with it so far, unless otherwise the edits are done at the far away points, but otherwise it's a centralized system. We also look at cloud computing. Cloud computing here we refer to, for example, if we look at the system of the IT systems we have. Okay, you have we have here, for example, you have a mobile phone, you have a laptop or printer, and then all these are receiving information from the router, which is the internet. Maybe we have a desktop and all this receiving from the internet. So the cloud computing is like a kind of supply system where already we are getting services through the internet, through the network. We are not longer getting like physical kind of softwares. Okay, so just through the cloud you can have application that you can just download online, and then already it works. Okay, we can have the software platforms, even storage space, application, visual desktop, and then the servers. So here we don't need like to do really a kind of physical kind of inventory, but you could just do it online. So with all this, we have come to the end of our lecture. Thank you for being with me, and see you in the next session. Bye bye.